Good evening to the Berkeley community. I'm Mayor Jesse Adeguin, and thank you for joining us for this COVID-19 town hall. It's been 2 months since our last town hall meeting, and a lot has happened. We've learned that we've reached a grim milestone here in the United States of over 700,000 people have died due to COVID-19, including people in our own Berkeley community. I think that really impresses upon us the importance of continuing to follow our public health requirements and guidance to protect our community and to help us get through this pandemic. But in addition, there have been some developments here in the city of Berkeley, which I'm sure we'll touch upon. Our city manager has issued an administrative regulation requiring that all city employees must show proof of vaccination. Additionally, several weeks ago, we also instituted a public health order requiring that certain businesses must check proof of vaccination for patrons to enter the indoor portions of those businesses. And this includes businesses that serve food or beverage, fitness and gyms, and other congregate facilities. We also know that booster shots are now becoming more available to people. And we'll touch on the availability of boosters, and we received several questions around booster shots. And then last week, the governor announced that he is issuing an executive order to require that students and staff in our schools must get vaccinated by next year. And this is in addition to the discussions happening at our school board in our Berkeley Unified School District around a vaccination policy. So when we last had our town hall meeting, we were seeing a surge in cases in the city of Berkeley and also throughout the country due to the highly contagious Delta variant. And some of the measures that we have instituted have helped, as well as the continuing focus on increasing our vaccination rate in the city of Berkeley. And we'll get an update on our vaccination rate as well as on our case rates, and hope we can touch upon some of the effort that we've been engaged in to do focus outreach to individuals who have been concerned about the safety or efficacy of vaccines, and particularly targeted outreach to communities of color and students and young people, so we can increase those numbers. And not surprisingly, we're seeing a disproportionality in terms of who's getting vaccinated on the basis of race. And this is just builds on I think the very pronounced disparities in terms of who's been impacted by COVID-19 nationally and globally. So with that context provided, I want to now turn it over to our City of Berkeley Health Officer, Dr. Lisa Hernandez. And Dr. Hernandez, thank you for joining us this evening. And if you could please update us on our case rates in Berkeley, and particularly on the progress we're making in vaccinating our population. There has been a health order that's been issued since our last town hall meeting, which I did touch upon. And any other information you'd like to share with the Berkeley community on our response to COVID-19.
Good evening, Mr. Mayor and City of Berkeley residents. It's a pleasure to be here today. I'm in a different spot, same house, but different spots. So hopefully this is good news. I get to move around, but just wanted to start as usual with the numbers, starting with Alameda County and then focusing in on our city. So for our cases for Alameda County, we are now at 110,361 cases of COVID-19. In terms of hospitalizations, and this includes City of Berkeley residents as well, currently about 114 individuals hospitalized in Alameda County hospitals and 39 individuals in the intensive care unit. Those numbers are definitely better than they were when I made my last report in this forum in August. Definitely decreasing, still a bit higher than we'd like those two numbers, especially the hospitalizations, to be. When we look at the key measures, indicators for spread of COVID that we use both county and city level, our case rate for Alameda County is now down to 9.4 cases per 100,000 per day. And when we met last, it was at 17 cases per 100,000 per day. And test positivity overall for the county is at 2% test positivity. So again, much better than back in August. Also better are vaccination rates for the county. Overall, 12-year-olds and older fully vaccinated now are at 78.4%, and are fully vaccinated, and 91.3% of 12-year-olds and older have received at least one dose, and these are county numbers. So now I'll focus in on City of Berkeley numbers, and for our cases, we're now almost at 5,000 cases. We're at 4,910 cases, averaging about 7 cases per day. When I gave my report last in August, we were averaging about 16, 17 cases per day. So definitely half of that, which is excellent in terms of our surge. It seems like we've peaked on that, which is excellent. Total hospitalizations for City of Berkeley residents are 154, with 3 individuals currently in the hospital. That's better than we were back in August, still a little higher. Of course, I'd like that number to be 0 people currently hospitalized due to COVID that are City of Berkeley residents, but we're at 3 individuals at this point. In terms of deaths, we're at 55 total. That's an increase of, I believe, 5 since my last report. And all the individuals to date who have succumbed to COVID are unvaccinated. When we look at our testing numbers, we're still averaging a pretty high amount of testing per day at about 1,700 tests performed per day. That's our 7-day average. That's almost 3 times the amount that we were seeing back in August. So demand still continues to be high. That includes people who are requiring to be tested due to work, our Cal students who are getting tested, as well as people who are getting tested because of their concern with Delta variant. When we look at our indicators, our case rate is total at 7.31 cases per 100,000 per day. And that's essentially half of what it was back in August. And our test positivity is down to 0.46%. So again, very promising indicators. Thank you, Mr. Mayor, for allowing me to make the announcement. I'm brimming with pride and happiness and thankfulness because we were able to announce that our vaccination rate for City of Berkeley is at 93% of 12-year-olds and older are fully vaccinated. Yes, if you see a tear, it is definitely a tear because I'm extremely thankful for the efforts of the community to adhere to our recommendations and really understand the importance of vaccinating. Our numbers have always been a bit lower than we've known because of the fact, something I call the Cal effect, which is essentially due to the fact that 30% of our population is UC Berkeley students, and we weren't getting those numbers captured in the immunization registry as we like, because of the fact that most of last year when people were getting vaccinated, they were getting vaccinated outside of City of Berkeley jurisdiction because students were home or in other sites, so we weren't capturing them. So the epidemiology team here in the city work with UC Berkeley to make sure that we are able to incorporate those numbers. So 93% of, I'll say it again, 93% of individuals 12 and older are fully vaccinated, and 97.5% of 12-year-olds and older have received at least one dose. So we're doing an excellent job, and we still have 7% to go. And honestly, we're focusing our efforts on some of that. And I'm maybe Dr. Vargas will mention some of that later, but essentially this is our overall numbers. When we look at race, ethnicity, you can see that on our dashboard. You can see that there are some differences in that number. And I wanted to talk a little bit about our dashboard. So not only was our vaccination rate updated due to, as I mentioned, calculating UC Berkeley students, which again are approximately 30% of our population. We also updated the numbers vaccinated on our dashboard. We also have added a link to University Health Services data, because then you can see the actual numbers from Cal. Essentially, they are the student undergrad and grad together are about 97.9% fully vaccinated. So that's a big part of our data. We also have our case and hospitalization and death rate categories have been updated as well on our dashboard. And the last thing in terms of our vaccination rate that I failed to mention is that we've switched our vaccination cap at 97.5 so that we align with Alameda County. So we'll never pass 97.5 for our cap, because we know that there's limitations to data. And we used to cap at 99, but now we're capping at 97.5, so we align with the county. I will go on to some other good news in terms of schools. Schools between the period that BUSD started, which was August 16th to about September 30th, there have been about 70 school exposure events. And what does that mean? It means that anytime a person who was infectious with COVID-19 might have exposed students and staff on either school campus or on a school-sponsored activity. And that includes BUSD, so public schools and private schools. So there have been those 70 incidents, but there has been no documented cases of disease transmission in the classroom setting. So we did, there are people who did go to school, whether they were staff, faculty, teachers, or students that were positive for COVID. There was no transmission in that setting. And that really speaks to the safety of the school setting, whether it was masking or screening or ventilation or distancing. Actually, all of those together have all contributed to having the school being a safe setting. And it tells you that those mitigation strategies are effective. We also are seeing high vaccination rates among eligible students and staff. So that's another reason why we're seeing that transmission level to be low. We also know that the high vaccination rate in our students allow those that are vaccinated to not need to quarantine because of the new state and federal guidelines in terms of quarantining for individuals who are not having to quarantine for if you are vaccinated. So as you mentioned, Mr. Mayor, there is a lot going on in terms of vaccines. No matter what, first and foremost, I encourage anyone who hasn't gotten vaccinated yet to consider getting vaccinated. That is still our number one priority, is to get everyone vaccinated that hasn't been vaccinated. Number two, as you mentioned, the boosters have been approved late last month. We're already in the 4th day of October, so that was in late September. Boosters were approved by FDA and CDC, and also within our Western states consortium, which includes, of course, California. And the guidelines recommend boosters for individuals who received their second dose of Pfizer. So this is only for individuals who have received their first series of Pfizer to get a booster of Pfizer vaccine 6 months after their completion of their primary series. And the individuals that are recommended to get vaccinated are 65-year-old and older, residents in long-term care facilities, and 50-year-olds and older who have underlying medical conditions. And those conditions include cancer, chronic kidney disease, pulmonary diseases such as asthma, either severe or moderate asthma, diabetes, high blood pressure. There's a list on the CDC website which gives you more detail on that. And also 50-year-olds and older who are at increased risk for social inequities, which includes communities of colors and others at risk for inequities. There are also suggestions for recommendations for individuals to get a booster, so not as strong of a requirement or a recommendation, and that is for 18 to 49-year-olds with underlying medical conditions, and those conditions are the same ones as I mentioned for the previous group, and then 18 to 64-year-olds at increased risk for COVID-19 due to occupational or institutional settings, and there is a description of that on the CDC website, and I believe there's a question about that in our queue. So I will go through those questions at that that category at that time. And lastly, as you mentioned, Mr. Mayor, the governor announced that COVID-19 vaccine would be added to the list of school vaccination for K to 12-year-old students, and there's a phasing in for that requirement. It will be implemented first with when students age grades 7 to 12 are going to be required to be vaccinated once the FDA grants full approval of the Pfizer vaccine. And once that happens, we have to wait to either January 1st or July 1st of 2022 when that requirement will become active. And during that same phase, not only will students in 7th and through 12th grade have to get vaccinated, teachers and school staff will also be required to get vaccinated as well. The second phase applies to students in kindergarten through 6th grade. And again, FDA approval for the pediatric vaccine. And then again, we would have to wait for that approval from FDA before that becomes effective. And this time frame, even though it seems several months away, gives us in the city and public health the opportunity to work with the schools and families to make sure people have an understanding and have all their questions answered regarding the vaccine. It's most likely possible that the vaccine will be added to the list by the legislature for school admissions or enrollment in the future. So at this time, once FDA approves for the 7 to 12 grade, then they will become effective either, as I mentioned, January 1st or July 1st. And there's still going to be an option for personal belief exemptions under this measure. If it becomes part of the legislative ruling, then there will not be an option for personal belief exemptions, which is what all the other vaccines for school entry belong to. I will stop there and hand it back to you, Mr. Mayor, and I'm looking forward to answering more questions.
Thank you very much, Dr. Hernandez. And thank you for addressing some of the questions around our school districts and case rates in the school district, and work we're going to be doing in partnership with the school district to do focused outreach to our people around safety of vaccines. Before I go to the city manager, I want to invite Dr. Vargas. Anything else you'd like to add, either on our efforts with the school district or on all of our COVID-19 response? If anything else you'd like to add, I want to turn the floor over to you.
Yeah, thank you, Mr. Mayor. And it's great to be here with all of you again tonight. It's been a while. I just, two things. I want to appreciate the massive efforts of my colleagues and our community to come lockstep around this incredible 93% vaccination rate. I think that actually puts us above Marin, which is quite impressive, not that we're competing, but we're just, it's just such a wonderful experience to really have felt a community really come together to make something this important happen. And so I really want to appreciate and thank everyone for that. And then I want to say that I also want to appreciate the voices of people who have not yet chosen to get vaccinated. I think that there's room for all voices in this conversation. And while vaccine is by far the most important tool, we also need to be empathetic for people's experiences, feelings, thoughts, historical connections to the healthcare system, and honor that. So I would welcome us as a community to also be able to listen, hear, talk to, and try to understand that voice. Our outreach efforts, we have been doing a lot of really great communications to the general public. The state has, certainly the City of Berkeley communications team has, and the county has. It's really time that we work to develop and really leverage our more deeper relationships. And so our outreach strategy is really going to become one where we are really working to connect with people, communities where we see lower vaccination rates from a place of understanding and information. We have been doing this actually the entire time with our unhoused population, where we have returned repeatedly to shelters to talk to people, to answer questions, and then slowly increase vaccination rates. We have been definitely adding numbers through our school-based clinics, and now we actually want to leverage our community-based organizations and our trusted voices in our community to really quite literally knock on doors and have conversations and then come back so that people actually have time to think, to consider, and to feel like they are in the end making their own decisions. And as we do that process, which can take a long time, one thing that we can be particularly grateful for is our vaccination rate currently is so high that people are protected in many, many spaces. And so we have the time at this point to really do that deeper work, which is just going to be in the end the most important thing we can do to help get people on, to help support people in their decisions and to get more and more people on board. So that's all I wanted to add, Mayor. Thank you.
Thank you so much. Now I'd like to turn the floor over to our city manager, Dee Williams-Ridley, to provide an update on city operations and our response to COVID-19.
Thank you, Mr. Mayor. It's been a short time since we've last met, and I've had the opportunity to speak with you all and our community. So it's really good to be here. Our city we continue to work through the pandemic, and I really want to thank our community for embracing the many changes that this pandemic has brought to all of them. They have embraced the change, they have walked the walk, they have worked really hard to keep each other safe. To our city leadership and the leaders on this call, Mayor Yu and our health officer and Dr. Farhus, that leadership has been tremendous, and the support from our council and our entire staff. There's just been a long-term commitment here, a 20+ month marathon that we've all been running together. And I just want to thank everyone for their support, and of our business community and our residents and just each other. So a big thank you to everyone. What I want to focus on, and I know there are going to be questions that we'll get into around the pandemic and our administrative regulations, so I'll wait for those. But I do want to spend some time just talking a little bit about our unhoused community and some of the changes that have occurred since we all last got together and met. So as you all know, with the and I'm going to share some excerpts from information that we put out to our community, and I want to reiterate those things because I think it's important to share some of this narrative. With the passage of Measure P, our residents generously voted to tax themselves to support efforts for our homeless, to address homelessness here in Berkeley. And these resources, they've made a significant impact. Since 2018, we've created 95 new shelter beds at our Stair Center, and the Horizon Transitional Village program has expanded its permanent housing capacity by 209 units, including new competitive funding from HUD, and this has increased mobile outreach services. All in all, our services have successfully rehoused 485 people since 2018. All of this pre and post pandemic. Additionally, with the support of voter-approved Measure O, the Berkeley Way project with 53 units of homeless housing, 42 homeless shelter beds, 89 affordable units, and a homeless service center will be opened in the near future. And many of you can see that as you walk down our streets and you walk through or drive down Berkeley Way. When the COVID-19 pandemic hit in March of 2020, much of the momentum to shelter our homeless in our city and clean public areas was paused. And the city, we scrambled to protect people, including our most vulnerable residents, from the serious illness and death. To comply with the health order, we reduced our shelter capacity to enable greater physical distancing. This had the unfortunate effect of reducing the number of year-round shelter beds. From, I believe, pre-COVID, it was 256 shelter beds to 129 beds. In response to the pandemic, and this shifted, and this had a tremendous effect on our homeless community, as well as the way in which we can refer people to housing and a safe environment. The city also shifted its winter shelter model from an inclement weather only shelter to a every night shelter bed between November 30th and April 15th. This increased the number of shelter beds available by 19. And then in July of this year, we opened a 50-bed shelter, the Horizon Shelter. It's on Grayson Street. We did this to comply with guidance from CDC also, which advised communities across the nation to not clear homeless encampments without first making offers of individual rooms to every resident. We paused our efforts to close even the most dangerous and entrenched encampments. The pandemic also created serious challenges to the city's enforcement capacities, as many staff were forced to work from home and some of our outreach staff contracted COVID and were unable to work. So we've had impacts, as well as our community having lots of impacts, but particularly our homeless community has had tremendous impacts as well. The road ahead, with the high rates of vaccine uptake in Berkeley, as our Dr. Hernandez has spoke to, we are reopening our economy, and we agree the current conditions that we see on our streets, and we've seen progress as well, that those are unacceptable in the areas which cause tremendous health and safety concerns to our community and residents. So we've begun enforcing applicable municipal codes to reduce the impacts of encampments in our parks and our streets and sidewalks. We always seek to encourage voluntary compliance first. It's very important to me and our teams that are working out there on these issues by providing outreach services and real offers of shelter. We do this not only because it's the right and effective thing to do, but because we must comply with federal court rulings that have upheld the constitutional due process rights of people living outdoors. Since July, when enforcement was initiated, we successfully moved 47 people into the Horizon Shelter and have removed over 26 tons of garbage and debris from encampments during the course of enforcement of our sidewalk and park ordinances. We know that there's a lot of work to be done. The pandemic and the ensuing CDC guidance and serious staffing challenges that has been created by the pandemic has resulted in a huge backlog of over a year's worth of enforcement work. Given the backlog, we are prioritizing the largest and most impactful encampments from a health and safety standpoint. For example, we partnered with Caltrans in Alameda County to successfully close the largest encampments at I-80 and University, conducting weekly outreach for 3 months and eventually moving 50 people into hotels and shelter beds. Additionally, we have closed encampments on Durant and Alston and moved a number of people out of parks and other sidewalks and into the Horizon Shelter. We're enforcing our ordinances, but what took a year to build cannot be solved overnight. We do have some more changes happening right now. We have opened up our first off-street safe parking program for people living on our streets in RVs. The Safe RV program will provide temporary parking accommodations for up to 40 households living in their RVs. This work began last week and will continue into the next week. I want to pause there, Mr. Mayor. I can go on and on, but I do know we have a number of questions, so I just want to thank our community and ask them to be patient as we move through some of these critical issues in our community. Thank you.
Thank you very much for that really important update around how we are responding to what we've seen is a visible increase in street homelessness in Berkeley and all the array of services that we provided. And I know that there were some questions with regard to that. So hopefully that answers the question from a constituent. So with that, I want to turn to questions. We received a number of questions from residents. And the first question, and happy to direct to the city manager or public health team. How is the city working with our school district to promote vaccinations among students? I know we talk about a very high vaccination rate. I think it's what, 97% of BUSD students have gotten vaccinated. Correct me if I'm wrong, but my record is a pretty high number of students in the school district have gotten vaccinated who are eligible, who are Berkeley residents. But maybe touch a little bit about the work we're engaged with the school district around reaching out to and promoting vaccinations to our students. I know there's a vaccine clinic that was just been announced by the superintendent, I believe, on Saturday, October 9th at 1901 Russell Street. But I don't know anything else Dr. Hernandez or Dr. Vargas can add about our work with BUSD.
And I know that Madam City Manager has also been very involved in the work with the district and has very regular, frequent conversations with Superintendent Stevens. And we really appreciate the partnership from the leadership level down to the ground level. So I want to I'll name that. We have worked really closely with the school district throughout the course of this pandemic. And I think we've reported in these town halls on them. So I'll just really speak to what we've been doing more recently. First of all, when vaccinations became, when young people 12 and older became eligible for vaccination back in, I believe, May, we quickly and abruptly worked with the school district to host some vaccine clinics that, based on the timing, by the last day of school, many students were able to get their second vaccine. So that was really exciting. So we've hosted clinics at Longfellow, we've hosted clinics behind City Hall across the street from Berkeley High, we've hosted clinics at BTech, and we'll continue to co-locate clinics where we can. We've also been very, very active in partnership with the school district since the opening of school. And I don't know about you all, but that first day when I was driving into work and suddenly traffic changed and kids were on the street, that was an amazing, amazing moment in this pandemic. And we were in constant communication with the district that whole week as we were working both to combat Delta and also to help keep kids in school. And I can't be more appreciative of all the efforts and the work that all the schools and BUSD in particular have done to keep kids safe. As Dr. Hernandez said, we really don't have transmission happening in schools, and that is because of those cautionary measures that we have supported BUSD in implementing and that BUSD is also working to implement rigorously. So that has been truly part of our partnership. I will say that unfortunately, with this very, very high vaccination rate, we do also see more students of color who are sort of don't have the highest vaccination rate of some of the other students. So we're in the process of expanding our partnership with BUSD to be able to really leverage the relationships that they have with their students, and many of their loved school staff have had with many of their students over the years, and really do much more significant phone calling, vaccine information sessions with trusted partners, working with both the district staff and our CBO staff to really provide the information in ways that are both affirming of people that are trying to make the best decisions that they can for themselves and their children, and also just continues in a relentlessly positive way to communicate with folks around the importance of getting vaccinated for the health of their kids, of the health of their families, and potentially the elders of their families. And so I'm really excited that we'll be entering into that level of a partnership there. So just really, really pleased at how well we've been able to collaborate and coordinate with the school district.
Thank you very much, Dr. Varhus. Madam City Manager, anything else you'd like to add about our work with BUSD? I know that you've been working very closely with our superintendent in coordinating efforts.
Yes, it's been a wonderful partnership. Of course, there's bumps in everything, but we've worked extremely close together through the leadership of Dr. Varhus and also Dr. Hernandez. We've been able to do a lot of tough, hard work with our school district. As a parent of a Berkeley High School student, it's always interesting and alarming when you get those emails alerting the community about an exposure. But what I will say is that I haven't had an exposure to the children that my son frequently works with or is in classrooms with. So it's just good to hear that the kids are keeping themselves safe too. And part of that is because of leadership of all of us and also the superintendent. One of the things I will say is that one of the lessons that we learned in all of this process and how we've gone through this pandemic is that having those frequent conversations about what's working well and what's not working, and those things matter and they help us navigate through these very extreme and charged situations. Parents care about their students, we care about our parents and our kids, so it's critical that we all stay together even when it's tough and hard. I know many of our community members are seeing across the nation where the issue of vaccinating students is polarizing for some, and it's creating very devastating results in boardrooms and in classrooms. And so it's important that we stick together, stay focused on what we need to do as a community and keep our children safe. And I want to just thank the superintendent for his leadership, because it is hard and it has been tough for him and me as a leader here in the city as well, and all of us. So we need to stay together. And I just want to thank you for this time to share that, Mr. Mayor.
Thank you so much. Another question around the recent policy that was instituted requiring city employees to show proof of vaccination. What is the latest on the policy around city employee vaccinations?
Mr. Mayor, can you hear me okay?
Yes.
Okay, great. So I'll give that update. I did release an administrative regulation, which is now in effect, and it requires that all of our employees must report their vaccination status by October 15th of 2021 and be fully vaccinated against COVID-19 by November 15th of 2021. And this is unless they have a medical or religious exemption. To be fully vaccinated, they must be, I think it's 14 days must have passed since an employee received the final dose of a 2-shot Pfizer or Moderna series, or a single dose of the 1-shot Johnson & Johnson vaccine. This full vaccine requirement that we've applied to all of our employees, interns and volunteers who are not otherwise subject to the state of California local health orders pertaining to vaccinations in the workplace. In which case, those state or local health orders may and are oftentimes more stringent requirements. Employees that are subject to state or local health orders must comply with any vaccine verification or testing requirements that are stricter than those set forth in the policy that I released. And our city intends to fully comply with state and local health orders and applicable laws. We have provided our employees with, information on where to get vaccinated. People can go to myturn.ca.gov. You can also find city coordinated clinics and other information at cityofberkeley.info/vaccine. So by October 15, 2021, employees must submit their proof of vaccination, and they'll do this in one of two ways. They'll show proof of vaccine by either using an online form that we've created here in the city. They can also submit hard copy self-certification of COVID-19 status. And our AR is available to our employees to review, and it's also available should the public wish to receive a copy of that administrative regulation. I'm not sure what else would be helpful. Again, employees who are unvaccinated or incompletely vaccinated as of November 1st, 2021, which is 2 weeks before the full vaccination deadline, must comply with the City of Berkeley's testing requirements as set forth in the administrative regulation policy. And so there will be somewhat of a testing and or compliance to the vaccine attached to the policy as well. All employees, we must continue to wear a mask with testing and other safety requirements, including but not limited to the health officer order for the wearing of face coverings in indoor settings. And this order directs that face coverings, my administrative regulations direct that face coverings shall be worn regardless of vaccination status over the mouth and nose and in all public settings, venues, gatherings, and workplaces. So that is the update that I have for you at this time. Thank you.
Thank you very much. And I just want to thank you for implementing this very important public health policy. And I know it has not been easy. And the City Council on September 14th adopted a resolution not only extending our declaration of emergency in recognition that we still face a significant public health risk due to the spread of COVID-19, but additionally authorized the city manager to implement this policy while we are meeting and conferring with employee unions around the impacts of the implementation of the policy. But I think the council felt, and I know many people in the community also share the sentiment that given the spread of the Delta variant, it is critical that we look at implementing mandates. Delta is highly transmissible. It's not only a risk to our employees, but also to the public who come into daily contact with our city employees, who come to City Hall to access government services. And so this is really important to protect the safety of our employees and to protect the safety of our community. So I want to thank you, City Manager, for implementing this policy. I think it's really important. Obviously, we hope that there'll be some point in the future where we have gotten, a really good handle on COVID-19. I think we're making great progress in Berkeley, but given the threat that we face due to the Delta variant and other variants that we don't know about yet that may be transmissible, this is a very important step. So I want to direct the next set of questions to our health officer and our director of health, housing, and community services. There are a number of questions around booster shots. I guess the first question is, are restaurant workers included in those who have at-risk jobs and can get a booster shot? And I believe that I believe that individuals who work in high-risk settings could be eligible for boosters, but Dr. Hernandez, you can elaborate and update us on who's eligible.
Sure. And of course, my Wi-Fi is a little wacky right now, so I'm going to go by memory as opposed to looking at the actual form. But yes, farm and restaurant workers are included, first responders, which include healthcare workers, emergency personnel, whether it's EMS or for those that are in law enforcement. Also, individuals who work in grocery stores or convenience stores are also included into that group. And there's probably a number of others. Let's see if I can pull this up actually. Here we go. I try to, food and agricultural workers, manufacturing workers, correction workers, U.S. Postal Service workers, public transit, grocery store workers, as well as education staff, teachers, support staff, daycare workers, and the first responders, as I mentioned, healthcare workers, firefighters, police, and congregate care staff. That's the list from CDC. As of today, though they can add additional occupations and settings as we go along.
Thank you so very much. There was a question on booster shots. Are people who are eligible for a booster shot but have not gotten one still considered fully vaccinated? I think have you gotten 2 full doses that you are considered fully vaccinated, certainly for the purposes of implementing our vaccine mandates. But Dr. Hernandez, want to turn over to you.
That's a great question. There are a lot of great questions tonight, as usual. But this one is true. Yes, you fully vaccinated still continues to be completing a full series, whether if it's a 2 dose series 2 weeks after you complete that 2 doses, or if it's the Janssen vaccine 2 weeks after that 1 dose. Even if you're eligible for a booster or not, we're still using the primary series to consider someone being fully vaccinated.
Thank you very much. There's a question around Moderna boosters. Some people are getting Moderna boosters. Is this kosher? What about J&J boosters?
Yeah, I saw that on my next door last night. So they even gave you suggestions of where to go. That said, it is not kosher or legal to be doing boosters. You can get additional doses if you are considered by your primary care provider to need it. So there is, remember that initially we had those that were at risk for not fully responding to the COVID vaccine to have an additional dose. So that includes both Pfizer and Moderna. But in terms of the booster, it's only for Pfizer. So you have to complete your Pfizer series and then get a Pfizer dose. If you completed your Moderna, like myself, I had Moderna, even if I fell into those high-risk categories, I cannot get a booster yet. And same thing for Johnson & Johnson, the Janssen vaccine. I'm expecting Moderna to follow suit probably in the next month or so, but again, it all depends on when they turn in their data to FDA. And we'll see about Johnson & Johnson in terms of what the timeline is for those boosters. But right now, you have to have completed a Pfizer primary series, and then 6 months after that, you can get your booster if you fall into those categories I mentioned earlier.
Thank you very much. There were a couple of, well, before we get to the questions on our mask requirements, there was a question on how we're doing in addressing COVID-19, and particularly where are we at compared to other cities and states. I'll just highlight what you announced at the beginning. I'm very excited that we announced it today on this town hall, that the recently published data on our COVID-19 dashboard show that when you include UC Berkeley's data, that 93% of people aged 12 years and older in the city of Berkeley are fully vaccinated. That is a huge accomplishment and would not have been possible if it wasn't for all the hard work of the leaders assembled here tonight and of the Berkeley community that has just from the very beginning followed science and have really prioritized the health and safety of not just ourselves, but our neighbors, and have recognized that vaccines are safe and effective and are really critical for us to control this deadly pandemic. But I think on the whole, the statistics that you noted, Dr. Hernandez, around case rates, 0.46% test positivity rate, a case rate of 7.31 per 100,000 per day. That's half of what it was in August. I think it's a really good indicator, but I want to turn it over to you since a lot of this is due to the hard work that you and your team have been engaged in over the past 20 months to maybe just elaborate a little bit about, how we're doing compared to some of our neighboring cities. And certainly we see that map, on CNN where of all the states in the United States, and California is yellow and all the other states are red. And I think even within that yellow state, I think Berkeley and the Bay Area has been doing a really incredible job of addressing this pandemic.
Yeah, if we put Berkeley in there, we'd be blue.
Yeah.
Which is the lowest in terms of transmission. And in terms of how we are, as you mentioned, Mr. Mayor, our case rate, our test positivity, our vaccination rate is a lot better than the state, is a lot better than even our county and a lot of our Bay Area cities and county public health jurisdictions. And in terms of competition, not that we're being competitive, Marin is at 91.7% fully vaccinated, and we're at 93%. But again, what we have similar to Marin and a number of other places is that we have communities that really appreciate and do follow science and do understand the necessity for having these participating in the life-saving measures that we have here in front of us, which number one is vaccine, number two, mask, and staying home when you're sick, and still being careful about going out, even though our restrictions have lifted. This doesn't mean, well, I don't think we'll ever go back to pre-pandemic times in terms of how we think about our risk as an individual and as a community, in terms of what impacts our actions have on ourselves, our families, and our community. So we're doing a lot better than our neighbors. And again, a lot of it has to do with the fact that our community has really appreciated and listened to the science. And then, yes, our staff has really worked hard, tirelessly. The schools, working with Cal, working with the community at large, as Dr. Varhus mentioned, the unsheltered population, the Office of Economic Development partnering with us, and the city manager's office with businesses. It's been a total community effort. So I can't say it was one group over the other, but it was really all of us coming together to put us in this situation. That said, we have to continue to move forward and to keep going. And we're getting into the holidays, so we know that kind of bumped us up earlier. I mean, last year as well, after Halloween, we started to see that rise. So I'm hoping once we get people vaccinated more, that as we mentioned, people who are still not vaccinated with their primary series, and then also working to get children once FDA approves and then CDC approves vaccination for 5 to 11-year-olds. Getting those children vaccinated is going to be another effort. We're already working to get, we have preparations ready for that, both in terms of clinics as well as working with community partners and schools in terms of getting that group vaccinated. I don't know if Dr. Varhus, you wanted to add anything to that piece?
I'll just add that we have been doing pretty deep planning for the vaccination of children ages 5 to 12, which we expect or anticipate will happen by the end of this month, which is amazing and exciting. And I just want to share with the community that it's a little bit different to give shots to children that will be showing up with their parents than it is to do this sort of mass vax thing at Golden Gate Fields. And I just want to assure the community we are very thoughtful about that. We have identified a number of locations and are really working to try to plan something so that it can be the best possible experience. Fortunately, many of us know the vaccine itself is pretty painless for the most part, and that's great. But we want to really support those parents that will be coming and caregivers that would be coming with their kids, and make sure that it is very structured and supported.
Thank you so much. There are a few questions on face covering requirements, and kind of two different polar sides of the perspective. Keep them and maybe get rid of them. So the first two questions were just around, given, as you said, we're about to enter the holiday season, and face covering requirements have been, and high vaccination rates have been really critical to help our community manage the spread of COVID-19. Um, there's a question as to whether we should, continue to require face coverings, particularly during the holiday season in order to help prevent another surge. And then moreover, there was a kind of a question from a different perspective around what is the quote end game for dropping mask mandates.
Yeah, I love the fact that there were both those questions there, because we could see it in both ways in terms of the fact that we do have a highly vaccinated population. That said, we know that we can't rely on one measure to keep our community safe. Hence why we reinstituted masking for indoor public settings. And it's not an easy answer to what my end game is in terms of when we're going to be able to lift that mandate. We have discussed it both internally as well as a Bay Area, because as you remember, we instituted that measure with other Bay Area colleagues. So we want to be able to be very consistent in terms of our criteria for lifting. That said, we may not wait for every jurisdiction to meet that criteria, but we are not an island here in Berkeley, so there's a good chance that we will move with the county in terms of those lifting of those mandates, because we know that we had to align with them when it came to the tier status imposed by the state. But in terms of masking, we can move singly, but we know that we're not an island. We move back and forth between our borders. So we are looking at considering when we would do that. There's a chance that we would consider phasing in the lifting of the mandates based on our vaccination mandates. But again, there's a lot of factors, including, as you mentioned, Mr. Mayor, the fact that the holidays are starting, and we may see an increase in not only in our case rates, but the other piece that we really also look at is the severity of disease and protecting the capacity of our hospitals, not only looking at the impact of COVID on hospitalization status, but also other diseases. We're going to have a flu season this year. There's respiratory disease already circulating in our communities, and it's COVID and other respiratory diseases, colds and other viruses that we've lived with for years that can be severe for individuals, especially those with underlying medical conditions. So there's a lot of factors that play into this decision, and it's not just the COVID numbers, case rates, it's not just the vaccination rates, it's not just COVID hospitalizations, but it's also the hospital capacity that we have to look at in this new era of being able to exist without restriction. So it's not an easy answer to, and I'm talking a lot about it because there's a lot of different factors that we're dealing with, and we hope to be able to have that information for you soon in terms of when we might be able to lift it. But at this point, I celebrate the fact that we're 93% fully vaccinated and that our case rate looks low. And I hope that we continue on that trajectory.
Thank you so much. There was a question around immunity. Please clarify when folks are infected that they can indeed get reinfected with COVID-19 and that there are mutations. Some folks believe they are immune if they have contracted COVID-19. Can you just indicate whether this is true or false information?
It is true that if you've gotten COVID once, you can get it again. You do have an immune response that is going to be stronger than someone who has never had COVID or never been vaccinated, but you still can get COVID. So that is why we recommend vaccination for individuals who have had COVID in the past. The only restriction is being out of isolation from COVID. So if you had COVID and you get removed out of isolation today, tomorrow you can go get vaccinated if you'd like. So we still do recommend vaccination for individuals who have had COVID in the past, because we've seen waning protection from even natural immunity.
Thank you so much. There's a question on indoor dining. Why are people who've had COVID and have natural immunity not allowed to dine indoors? I believe what this question is suggesting is that why they may be restricted from dining indoors if they don't show proof of vaccination. Because if you are vaccinated and you show proof of vaccination, you are allowed to dine indoors. There is no prohibition on dining indoors, if you show proof of vaccination and you wear a face covering when you're not eating or drinking.
Yes.
So hopefully that answered the question, but if you are not vaccinated and you are trying to go to the indoor portion of a business and you may have had COVID-19 previously, you still have to show proof of vaccination.
Absolutely.
And the recent public health order that was instituted in the beginning of September does not exempt individuals who previously contracted COVID-19 and are unvaccinated. So we want to just provide that clarification. You must show proof of vaccination if you're entering the indoor spaces of a business that serves food or drink. If you want to dine outdoors, you do not need to show proof of vaccination, although different businesses can set their own requirements if they so choose. Question on travel. Current testing cannot ensure that test results are available in time to meet international travel deadlines. Can there be a guaranteed date for getting test results? If not, what is the best resources for getting official results in a timely manner? But I think they're referring to, either accessing some of the testing that the city provides, either through Curative or through Optum. I know that you can buy a rapid test and bring it with you. But I don't know, Dr. Hernandez, if you have anything else to add. I have not traveled internationally, so I can't attest to what those requirements are, but I do know that you do need to show proof of a negative test within a certain amount of time prior to boarding an international flight or take a rapid test.
Yes, and I haven't traveled international either, but I was not an international traveler anyway. But that said, I think they vary by country and also by airline. But I believe in general, it's about 72 hours before
72 hours.
travel. And what I can tell you from the state data, this is from last week, they were pretty much turning around their testing in 48 hours. They were, I think it was like about 70% of tests were turned around in 48 hours, and then upwards of 90 in 72. And those are that includes our site at West Berkeley Senior Center, which is one of the sites from the state. Others, as you mentioned, I don't know if certain airlines are allowing you to use the rapid test, but I know that there was definitely a run on rapid tests and the CVS's and all the Walgreens and all the other pharmacies. So again, it's just a matter of planning ahead. And unfortunately, I cannot tell you, I do not control the testing, but it seems like a good portion of the turnaround is done in about 48 hours. Dr. Varhus?
Yeah, I can share, Mr. Mayor. I have an 80-year-old mother-in-law who we hadn't seen in almost 2 years that we were finally able to visit. And it is a little bit stressful, that testing requirement. What I will say is we can't be dependent on our lab results, and they seem to change based on surge. So when, like last month, when tons of people were being tested, the results were like 4 or 5 days late. I got tested like 2 weeks ago, last week, and I got my results in 30 hours. So it's a little inconsistent. What I do know is that for a fee, the airports, you can get tested. If things fall through and don't work, you can get tested at most major airports, and they'll turn a test around that is a qualifying test within a reasonably short period of time. And so people should look at that as options if that's the decision that they need to make. But it is difficult. And again, we don't, the results are sort of out of our hands because they're based on lab work. But the airport is a good resource, and there's other resources that people can look to that are more private in nature.
Thank you so much. I know that SFO has a rapid sort of test site, and you can make an appointment to get tested there. Okay, thank you for that information. It's a question on vaccine trials for kids under the age of 12. I know that the Berkeley Public Health Division does not have the responsibility for approving vaccines. However, what is your best guess for why childhood vaccine development has lagged so far behind adults? I think particularly, I think what they're referring to is the trials and the sort of the analysis of the safety of the vaccine for kids, which I know is underway right now for kids under the age of 12.
Well, vaccine approval and testing happens in phases, no matter whether it's COVID or whatever the vaccine happens to be. When we were doing, can't remember if it was chickenpox or something called rotavirus. That was the more recent, or HPV. Maybe it was HPV virus was the more recently approved virus vaccine. And what happens is it always goes through adults first, and then that gets approved, and then we do children, and it's a slower, even though the testing process is the same in terms of recruitment and testing for safety, what have you. It's a little slower because we're dealing with children and children of different ages, and children aren't just little adults. I used to always wonder what that meant until, A, I had kids, and B, you look at their physiology and how they develop. So that's one of the reasons. One, we have to go through the phase of the adult testing first, and then we go through the testing of the children. And you see it actually even with the vaccine for, looking at Moderna, Johnson & Johnson, and Pfizer. Pfizer always is first because that was the first vaccine that was approved. And then you see Moderna coming after, usually about a month or so after that, because you have to have a certain amount of collection of information before we can move forward. So that's what's happening. And with children, they're looking at dosing as well. Whether they should use the same dosing, especially for the younger children. So those are the pieces that are included in determining approval.
Thank you. There was a question on how can somebody get electronic verification of their vaccination if their vaccine is in Alaska? I don't know if Alaska has an app or some sort of website where you can get a digital record, but I know a number of states are implementing that technology. Moreover, I'm assuming there's some physical record that the state of Alaska provides individuals. A photocopy or a picture of that suffices to meet the verification of vaccination requirements per the city health order.
Absolutely.
So I can't speak to what electronic system Alaska has, but if you have a physical copy of your vaccination record, that a picture or the actual physical copy, that I believe that meets the verification requirements.
Yeah, it meets our verification requirements, and I believe pretty much every other requirement, both at state and potentially some of the other jurisdictions. That said, if that individual can't get it, they can try, we can try to help them figure it out if they want to email us at the COVID-19 email, information email, which is covid19@cityofberkeley.info. We'll try to help, but again, as you mentioned, Mr. Mayor, this it's going to be working with the state of Alaska for these. But if they have a vaccination card and have a picture of that, that'll work. Quite frankly, I have both my little QR code from the state and a picture, and my picture is easier to get. Maybe I'm just too old school, but for me, I just pull it up and I have that, and I'm better at that. So, and that's worked wherever I had to use it. But again, if that individual wants to, we can try to help, but it's really lies with Alaska.
Thank you very much. Just a few questions I'm going to address. One is around outreach to individuals and groups that have not yet been vaccinated. And this resident has stated that they've heard that particularly marginalized communities have been reluctant to get vaccinated. And are there outreach efforts or other ways of supporting those communities? And I'm happy to elaborate, and I'm sure Dr. Barhus can, or Dr. Hernandez could add to my response as well. You know, at the beginning of our vaccine rollout, this was, January of this year, looking at the data and, in conversations with people in the Berkeley community, those that were getting access to vaccine were people who knew how to work the system, to be quite honest with you, and could, go to a mass vac site or set up an appointment with a doctor to get vaccinated. And there were racial and economic disparities, and there still are, in terms of who is getting vaccinated. And that's in line with just what we've been seeing overall in terms of who's been impacted by this pandemic. It's people of all ages and races have been impacted, but there's been a disproportionate impact on African Americans and our Latinx population in Berkeley and in the state of California. So, I was deeply concerned, and I think the leaders here were also deeply concerned about the disparities in who was getting vaccinated. And so, we have been working over the past several months, working with faith leaders, working with nonprofits that work with our immigrant and refugee communities, that work with our African American Latinx community, working with our school districts, to not only get information out in our community about the safety and efficacy of vaccines, setting up clinics, pop-up clinics at churches and nonprofit organizations throughout Berkeley to get vaccine out into the community, working with our school district, having pop-up clinics on school sites, like the one we announced previously in partnership with BUSD, working with the BUSD's Office of Parent and Family Engagement to do particular outreach to families of color. And while we've been engaged in all these efforts, we know that there's a lot more that we have to do, because if we look at that 8% that's not vaccinated, a disproportionate number of those people are people of color, students of color and families of color. And so our work remains to address the issues of equity in terms of how we respond to COVID-19. And I don't know if Dr. Hernandez or Dr. Barhus, you want to add about some of the work that we're going to be engaged in through, bringing on a team to work with the city to do more public information outreach to our community, and to do some focused outreach to kids and families around the safety of vaccines, so we can try to get as much as possible to that 100% vaccination rate.
That was really well said, Mr. Mayor. I don't know how much I can actually add to that. But what I can say is, yes, we have we are in the final contract routing finalization of contracts with some CBOs that we hope will continue to work with us. I know you have been wonderful around convening a task force around vaccine and COVID equity, which we continue to get feedback from, and hopefully we'll continue to do so because they've been outstanding. We are working with the school district to develop a more deeply relationally focused outreach, literally calling people, literally knocking on doors, literally connecting with people so that they can to help support their decisions around getting vaccinated. And as I said earlier, it's very helpful that we have the high vaccination rate that we do. And because without being vaccinated, this population is more vulnerable to COVID. We also want to continue with the same urgency that we have pursued all along, especially with the holidays coming up. We will get some messaging support. We are going to be working with young people to talk with young people about vaccination, because we all know I have 3 children myself, and I know that they listen to their peers more than they listen to me. And so just really working really distinctly around who trusted messengers are in different communities, and really having that dialogue and conversation as opposed to a more sort of hierarchical approach. So that's our intention. And I'll say also, I'll add, we have been doing that all along with our unsheltered population and some others as we've provided these context-specific vaccine sites. And so we're just going to deepen that work even further at this point.
Well, I just want to thank you and Dr. Hernandez and the city manager for your commitment to equity in how we are advancing our response to COVID-19. Actually, one of the benefits of having our own local public health jurisdiction is that we can really tailor our efforts to respond to the needs on the ground in the Berkeley community. And I know that we're all deeply rooted in addressing equity and reducing health disparities, and that also is, I think, one of our priorities in how our city government is responding to this pandemic. So, final question is on university. What is the penalty for not getting students to comply with vaccination mask mandates? I understand that if you don't get vaccinated, that's a violation of the student code of conduct, I believe, and there are actual consequences. But Dr. Hernandez, you would know better than anyone. The university has to comply with our public health orders, even though they are a state institution. And our staff has been working very closely with the university on the implementation of our various public health orders.
Yes, well, their vaccination order, they're, as you mentioned, relying on their code of conduct, as well as providing education to the students. They themselves, before, as the students were coming in and before they were on site, were already providing outreach to students that were not fully vaccinated. So that in terms of vaccination, they're adhering to their policies and using the code of conduct, and also looking at enrollment, their enrollment status for this current, I believe, this current semester and the semesters to follow. But again, I think they've been pretty compliant with that. In terms of masking orders, again, yes, and the vaccination indoors, they are very clear on those requirements. I continue to meet with UC Berkeley weekly, and they've sought clarification when they need it to, even outside of those weekly meetings, to ensure that they have been compliant. And I feel very confident that they are complying. What happens in terms of enforcement is the same level of enforcement that we impose on any business that there are complaints or concerns about. If an individual finds that there's a concern, then they can alert us and let us know through 311, and we can work with that business, whether it's UC Berkeley or another business in our jurisdiction. And the more information, the better. If there's that information, that gives us a bit of opportunity to work with the business. If we're talking about Cal, then I can, speak with Cal and talk to whatever department or entity that is having concerns. So that said, I think Cal is another great partner, has been a great partner throughout this pandemic, and they do not hesitate to ask for clarification if they have concerns.
Thank you so much. So those are all the questions that we received tonight. And before we close, I want to give our city leaders an opportunity to make some comments. I'll just say, before I turn over to Dr. Hernandez, that what we announced at the beginning, that Berkeley has reached a really critical milestone in our response to COVID-19, that 93% of our population, when you include UC Berkeley statistics, have gotten fully vaccinated, is a really tremendous accomplishment. But I just want to emphasize that there still are 8% of our population that has not gotten vaccinated, and that while we can I think be proud of reaching this important step, which is really critical to helping protect our community, we still will continue our efforts to make sure that every single person in our city gets vaccinated, if they can get vaccinated, because that is the most effective way for us to fight COVID-19 and to get through this. We've made such huge progress over the last 20 months, from relatively stable to low case rates. As was noted, if there was a map of the United States and you put Berkeley, we'd be blue, some of the lowest case rates. But the risks that we face as a community still remains, particularly with highly contagious variants. And so that's why we've implemented a number of new orders and policies in recognition of the transmissibility and threat of the Delta variant, such as business mandates and mandates for employees. And we continue to monitor the data to make smart decisions based on science and protecting the health and safety of our community. But in closing, once again, I want to thank this incredible team of leaders for your tireless and selfless dedication to our community these past 20 months. And I want to thank the Berkeley community. I'm so proud to live and represent a city that has crushed the curve and has really just put first and foremost the safety of each other above anything. And we see throughout the country, we see governors and we see elected officials who deny that wearing masks protects the safety of our community, who refuse to get vaccinated and who are putting out misinformation. But yet in Berkeley, we have a community and we have leaders who believe in science and who are putting the safety of each other first and foremost. And this would not be possible if it wasn't for all of the sacrifice and commitment that the Berkeley community has demonstrated. So I want to just thank you all, everyone tuning in, for following science and for following these critical public health measures, and know that we're not out of it yet. And the reality is that we're never going to sadly be over COVID-19, at least not in the near future. But this is going to be the new reality that we live with. But I think we can effectively manage this pandemic and this virus while we are adjusting to a new normal. And I think the public health measures that we have instituted and will likely continue to institute, in order to protect our community, are essential. We must continue to follow them. So thank you to the Berkeley community, and thank you to the leaders here. And I want to turn over to Dr. Hernandez. If you have any final comments.
I could just say ditto. Because again, I want to thank the community. I want to celebrate this moment with our 93% fully vaccinated. And also, as mentioned, we do have work to continue to do with vaccinating those that are not fully vaccinated, whether it's communities of color or the 7% that is not fully vaccinated, that still needs more information and may get vaccinated with time and more support. The other thing is that I want to thank the community for continuing to follow the guidelines, whether it's vaccination or masking, or again, thinking about your risk as you participate in society again, which is amazing. And I'm hopeful that if we do see we won't see a surge. We might see a little bit of a swell or a blip during the holidays. And that is if we continue on this trajectory without any other variants. And I hope that we continue in that way and that we just have a little blip because of the holidays, and that we continue to move forward, and that when children are under 12 are eligible, that everyone comes and gets vaccinated. So all of those that are eligible get vaccinated as soon as possible. I will hand it back to you again with a word of thanks to the community, and also to you, Mr. Mayor, and to the city manager for her support as well.
Thank you so much. I just say that, once I've said this before, and, over the past 20 months, I think some of our public health officers have received enormous criticism and scrutiny. And I just have to say, in Berkeley, we're fortunate to have such an incredible, dedicated, knowledgeable professional helping serve as our public health officer. We stand fully in support of your leadership as you've helped us get through these difficult times. And I know our community also supports your leadership. And because of your leadership, we are where we are. And so I just want to thank you, Dr. Hernandez, so very much. I want to turn it to Dr. Varhus. Any closing comments?
I think all has been said quite eloquently, but what I will do is thank the city manager and also the senior leadership team from the city that have all had a variety of roles to play in all this, some seen, some unseen. Thank the mayor and the council for your ongoing support around our work around trying to slow and end this pandemic, and also to the community for all of your amazing ongoing just belief in science and that we can do this together.
Thank you. And Madam City Manager, final words for tonight.
Yes, thank you, Mr. Mayor, and thank you for everyone joining in and to our community. This has been a journey. We're in it together, and we've been in it together all along. And just to watch how supportive our community has been for these ladies on this call, it's amazing. And I'm really proud of them, their service to Berkeley community, and also the collaboration. As Dr. Barhu stated, our leadership team in the city of Berkeley has done a tremendous job managing this COVID. And these ladies at the helm, running the entire operation, along with our city attorney and others, I'm just really, really grateful for their leadership. And Mr. Mayor, thank you for having these for us and allowing us to join you as you speak with the Berkeley community on these issues. These are very important talks, and I really, really appreciate you and your service. Thank you.
Well, thank you, Madam City Manager. Thank you for taking time out of your busy schedule to connect with the Berkeley community, to answer their questions. I hear from people often how much they appreciate this. It's not common to have this level of engagement and access to the leaders who are helping develop and implement our response to this pandemic. And just really thank you so much for your participation. So with that, I want to thank you all for tuning in tonight. Stay tuned for information on our next town hall. With that, please continue to follow the public health guidance to wear a face covering, when required, to practice physical distancing, to remember to wash your hands, and get vaccinated if you have not been vaccinated. All of this is really critical to helping us continue to control the spread of COVID-19.